So just to remind people that the meeting is recorded and it will be shared on social media. Please do ask any questions in the chat box. Next slide, please. And this is our agenda today. We've got Kathleen Lee coming to talk to us about a project that she's working on. We've got Wakefield's big conversation with Anna, who will also be giving us a data update and the Omicron update. Vaccination update, Christmas communications update, and some really good practice from one of our COVID community champions, Paul, to finish off. And just to remind everybody at the beginning that we will be having another COVID community champions meeting next week, which will just be a half hour, same time, usual place. So without further ado, I wonder if we can move on to the next slide, please. And I will hand over to Kath and to Caroline. Yeah, that's the one. Yeah, that's the one, Hannah. Thank you. I'll hand it over to Kath and Caroline to give us a run through of the work that they're carrying out at the moment. Over to you.
Thanks, Kerry. I think Caroline has joined, hasn't she?
Yeah, I'm here.
Great, brilliant, good to see you. Shall I just kick off in terms of the context, Caroline, and then you can add a bit more sort of detail?
Yeah.
Thank you everyone for inviting us today, and apologies if some of you, and I know some of you have seen this presentation before, but we want to talk to you about a piece of research that we've got going on in Wakefield at the moment that has the working title, What's Up Across Wakefield District. Wakefield and District Health and Community Support is the charity that I manage. We are essentially probably the largest grant making organisation in the district, and we give grants to other third sector organisations that deliver projects and services to support people's health and well-being, especially those with the greatest health inequalities and those in the greatest areas of deprivation. Obviously, which Wakefield has many. We wanted to commission this work because Rocket Science did a bit of work for the National Lottery a couple of years ago, looking at the funding picture across the Yorkshire and Humber district region, and the region doesn't get its fair share of funding. It's disproportionate in terms of the numbers, the places of highest deprivation, and how much funding we receive externally per head. So we wanted to dig down into that picture more in Wakefield, and what we're seeing is that Wakefield has less charities per 1,000 head of population than comparable cities regionally and nationally, but also that the funding that we're getting per head is less in the Wakefield district, so it's less than half the national average. So as a grant maker, we wanted to use this piece of research to really focus and fine-tune where we want to put funding in the future, and that could be in the form of small grants that we do now. So we distribute about £300,000 a year, but we have the potential to do more, and we want to work with partners to actually deliver more so that we can have more impact into the areas which are the highest health and wellbeing priorities. So the work started probably September, Caroline, and we've got some interesting sort of early findings, but I think it's also got some interesting and exciting links to some areas of work that Anna's leading on, and also that are coming into Wakefield. So I know that we've got some community renewal funding money coming into the district, and I'm hoping that our research can dovetail into other pieces of work as well. So I'm going to hand over to Caroline just to explain a little bit about the stages of the research and where we are at the moment, and then we want to talk to you about peer researchers.
Yep. Okay, can we move to the next slide if that's possible? Brilliant. So so essentially this is it's actually quite a long piece of work, because in part what we're trying to do is we're trying to get everyone on the same page in terms of understanding the issues, and you know, one of the things that we've tried to do is to make sure that everybody understands what the data what we know about Wakefield as part of a data story. So we've developed an early report on that. So what we know that you've got some of the most deprived communities going in the area. You've got multiple areas of needs across a range of higher sort of vulnerability levels. You've got very high levels of school suspension and exclusion in comparison. That's interesting from a complementary piece of work that we're doing. And you've got far fewer charities and lower grant income per population compared to national average. So this is what we know about the area. And as part of our data story, what we've been trying to sort of pick up is to try to understand what's going on in terms of what we know from the public data, and then using our state of the sector understanding and work that we've done so far to better see whether the voluntary community sector has the capacity and the networks and the reach to kind of to provide that support, and if they don't, as part of our conversations with them and with others, what could be in place to help build their capacity up. So that's what we're trying to find out at the moment. We're trying to work out, is everyone getting access to what they should be getting and have access to support. We want to get better understanding of what it feels like to live in Wakefield district. What does it feel like, potentially for people that perhaps have barriers towards engagement with services, maybe through not being able to travel, people that might be have long-term sort of intergenerational unemployment, people that have health needs, and what does that look like and what does that feel like? And what we're then trying to do, once we've unpacked all of this and brought the stories together, both from the data, from the sector and from individuals, to look at how we can engage with across the Wakefield district and with other partners to look at a collective call to action in terms of support. So this research, whilst it's being it's independent research, whilst it's not necessarily part of the council's activities, what we're hoping to do is that the findings from it will help support what the council wants to do and other partners want to do across the district. So, even though Kath's funded it, we're hoping that it will get wider ownership across the piece. We're going to just share some early findings. I think if you go to the next slide. Okay, and what we've done in terms of the progress so far, we've developed a website called What's Up Across Wakefield District. I think that's now that is online, and what you'll be able to do is to go in there and find out information about all the consultation events, the data story, and other elements of what's happening. And I think I've just reflected in terms of where we are. In fact, my colleague James is in Wakefield tomorrow and Friday doing some consultation events with stakeholders and to help us access peer researchers, which I'll come to in a minute. If you go to the next slide. Thanks. So there are, as you can see, what we've done here is there's about 1,000 voluntary community and social enterprise organisations working across the district, and what we've been able to do is break that down from into groups. So you've got many organisations, of the highest proportion of organisation working in leisure, recreation and sport. And then the next highest organisations working in welfare and social care, which is again, it's quite interesting in terms of how those things have panned out. And the map on the right illustrates where those organisations are across the district. So at one level, it looks like there are organisations in all the sort of key areas, doesn't it, Kath? from that map, and the chart at the bottom just talking really where Kath was coming from in terms of her role as a funder. As you can see, these are the funders that are investing at the moment into Wakefield, but as we've already said, you proportion, you don't get your fair share, and I think what we're hoping to do in terms of shining a light on need and what the issues are in Wakefield, and getting the shared understanding of what they are and getting that collaboration. We're hoping that this is going to give you the evidence and the insight that you'll need to go to try and convince more funding and investment into Wakefield over time. And as again, you can see National Lottery, you've got the Council, Sport England, Heritage Lottery Fund, so you've got the nationals in there, and you can see Wakefield down there in the middle. But you provide greater funding in children in need, which I think is interesting, Kath.
I'll just say as well that
yeah.
the Leeds Community Foundation, that will be national money that is distributed, that has to come through a community foundation, so it'll be national, so National Emergency Trust money, and Department for Culture, Museums and Sport will have come through that stream.
Yeah, brilliant. Thanks. Okay, if you can go to the next slide. So what we did here is look at the British Red Cross Vulnerability Index. Don't know if you've seen it. We use it quite a lot because it looks at vulnerability across a range of deciles. And I think we presented this to you, didn't we, Catherine, either in our submission or in our presentation. As you can see, there are sort of where the highest areas of vulnerability are in the sort of the dark blue and the purple places. When you then map that against the location of organisations working in health, you can see that perhaps they're not as clustered or operating where they need to, and that might mean that there's some sort of there could be some sort of deficit of provision. Now, we have to take that over with a slight pinch of salt to an extent, because the location of the charity doesn't necessarily represent where it operates. But I think on the basis that you have a majority of small organisations, it's a good assumption to make that actually there could be health needs, lots of potential people that have vulnerabilities not necessarily accessing services or support where they need to. So I think that's quite a useful reflection, really, in terms of the capacity and where we think there are or could potentially might be needs. If you want to go to the next slide. Okay, so essentially what we've been trying to do is to sort of pull the data together, and we have got some early findings that I think we will be ready to share very soon, and we're just completing that what we're calling a data story, and it's interesting because one of the things that we picked up was that Wakefield, you're awash with data, there's loads of it. I think what we're trying to do is to make sure everyone's on the same page and understanding what the data is saying. So sometimes there'll be things in the data story said, oh, well, we know that. And you might know that as professionals, as champions, as stakeholders in the community. But when we're going out and talking to communities and individuals and residents, having this information is actually really helpful to stimulate the conversation and start a conversation about need. At the moment, we are aiming to get at least 100 of the VCS organisations in Wakefield to complete a State of the Sector survey. So I think we've got nearly half of that so far. But what that survey is doing is helping us understand the health of the sector per se, so we can get an understanding of what their needs are and what their issues are. So if you've been asked to complete the survey and you haven't yet, if you could, that would be fantastic. We're coming to the close of some of the consultation events for this side of Christmas. We are planning more, but these events are really to talk to stakeholders and also help us reach out and recruit what we're hoping to start a training programme for in January, are a group of up to 20 peers. And we're training local residents to actually go out into their communities and conduct research on their needs, and we are still recruiting for those at the moment. So if you know if you're interested yourselves, or if you know of people that might be interested in taking part in some training to become a peer researcher and to support us in reaching out to people in their community who wouldn't necessarily take part in traditional research or consultations, then please get in touch. It is being paid at real living wage for the time, and we think it's going to be a good opportunity for people who might want to go into research or to go into support community work, and it could be a really good entry point for people to develop their skills. And we're due to start that training in January. So yeah, a call out for volunteers. We're also looking at trying to sort of understand what other research is happening, and I think since we started this, Kath, you've had all this other investment come through, which is great, and opportunities, and we've worked with the universities and taken up some of the students to help us with this research, so that's been good in terms of that collaboration. And I think once we've got all of our information together from the community consultation, from capturing some of the lived experience and the stories from individuals, and all of the data, we'll be running a series of design workshops where we'll get people to come around the table to look at the evidence, look at what we've been able to gather, and then to start thinking about how can we collaborate, how can we work together as a group of organisations, as communities, to get the best out of Wakefield, improve your investment into the area, and what support can we provide for the sector to make sure it's as strong as it possibly can be. Because I think at the moment it's not as strong as it could be, and there are various indicators around that. So what can we do to help drive that?
Yeah, and I think that's obviously we want to talk to key partners, Anna's team, CCG, the council, but our colleagues at Nova Community Foundation. It's important that we all pull in the same direction, and I think for me, I just want to say a final word about peer research, because that for me is the most exciting bit of this project. It's the bit that we can get to the real of information that we need. And I will be speaking to Jo Fitzpatrick. She's been in touch with me, Anna, so I know that you're keen to recruit people for the big conversation piece of work. And similarly, Lewis Connell-Smith. I don't know if you know that Lewis is working on a long COVID research project, and part of that, so he works in the Office for Health Improvement and Disparities, based in Leeds. And so this is, I don't know if it's a regional programme, but they're again recruiting peer researchers. So we want Wakefield to have some of those, and to create some sort of legacy from this as well. If we're skilling people up, we're building confidence in people, and we can call on these people again and again, and we can maybe sustain this as a model. Kerry, I will shut up now and then you can move on.
Brilliant, thank you, Kath and Caroline. That's absolutely fantastic. Hannah, could we have the next slide, please? Because I think it just want to let people know that there are some contact details there, and we'll share the slides as ever after the session. Really interesting work, really far-reaching going forwards. And sorry to cut you a little bit short there, but I do think we've got lots more to cover as well. And I think Anna's next presentation really links really well. So over to you, Anna, if I may.
What I'll do, if I may, is just go completely off my slides, because I think it'll probably be better. So just to say, it's great the work that Kath and Caroline are doing, and it's just incredibly helpful. And the bit that I'm the most excited about is the sort of peer researchers, and we really want to make sure that we use that asset that we'll have in the district. So I'll talk about that a bit later. So essentially, what we're trying to do as a council and friends, council and partners, is we want to hold something called a conversation. So just to give you an example of a couple of places where this has happened, Southend-on-Sea council held a big conversation with their residents. They talked to thousands of residents about what they wanted Southend-on-Sea to look like in 2050, and then they pulled that together into kind of a big priorities document, and that shaped the way they kind of delivered the services, etc., from the council. So we really wanted to sort of do a similar thing in Wakefield, and basically the plan is to train staff from the council and partners to deliver to go out and talk to Wakefield residents about what's good about the district. So actually at this point I'll go back onto my slide. Can I have the next slide, please? So I was just going to tell you a little story about how important it is to have conversations with people rather than just doing surveys or focus groups, which then very much defines what you want to talk about rather than what people may talk about. But I won't, because I think on this call we're all pretty convinced of the power of having conversations. So can we just move on to the next slide, and then the slide after that, please? So I think these community champions calls have really shaped a lot of thinking around how important it is to kind of have a direct mechanism between council officers and local residents and voluntary sector agencies, etc., to sort of share ideas and information and have that kind of two-way conversation. And that's why we really want to build on that with this piece of work. And again, I won't go through all these bullets because I think you know all of this already. But one of my sort of slight bugbears is that often what we talk about as being consultation is basically we've designed a service, this is what it's going to look like. You can tell us what you think about that. We might tinker a little bit around the edges, but essentially we define what the service looks like. Whereas what's much more powerful is to actually get people's stories, talk to people right from the beginning, blank sheet of paper, and build something together. And that's kind of where we want to get to. Might take us a while. We're definitely not there yet. I think it's probably a 10-year programme. But the big conversations, the first step of that programme. So next slide, please, Kerry. And again, most of the people on this call will work in a participatory way. That's just what you do. That's exactly how I worked when I was in the voluntary sector. It's just the natural way to work, but that isn't the case for statutory organisations. So what we really want is to skill up our staff in the council and other agencies to be able to work with residents and other groups and themselves, just within general staff teams, to be much more about coming up with solutions together rather than dictating things to people, and very much about helping people to do things for themselves. But in order to do that, we kind of need to start somewhere, and that's kind of why we want to start with the big conversation programme. Next slide, please, Kerry. So basically, we're going to go and talk to people. It's a conversation, not a consultation, and it's about finding out what works and what we need to do more of. And then the findings will feed into kind of some of our big plans and strategies, but also if, for example, I don't know, we're in an area of the district, say Featherstone, and a lot of people were really interested in climate change or really interested in reducing child poverty, or then we could do some additional work, participative work in those areas just to really understand what that means. And then we really want to change the way we work. So we want to change the way we do things. So part of getting staff who may never ever have done it before to go out and talk to local residents about their dreams, their aspirations, will be to help those staff to work in a different way. Next slide, please. So we're going to have 4 teams. There's going to be elected members, staff from across the council, and actually that's expanded now to staff from other agencies, children and young people, and then I've put community champions, but that's the conversation we really want to have with Kath and the team about how we can use the community researchers. What's really important to me is that people get paid to do this work. So that's why we want to use a mechanism that exists already where we can pay people, because some of the massive complaints that you often get back is that the statutory sector staff are paid but other people aren't, and that feels like it sets up, that's not fair. So that's kind of one of the things that we want to do, but we also see this as a bit of an organisational development programme for our own staff. So that's why we're not going to be asking voluntary sector agencies per se to put staff forward to do the conversations, but we want to work with the voluntary sector and yourselves in order to have the conversations. So if we just go on one more slide. And we're going to use appreciative inquiry. A lot of you will be aware of this. It's about finding the positives, what's strong and not what's wrong, is a good phrase. But it's also, the problem is if you go out to kind of a group of people, like older people, and say, oh, tell me everything that's bad about being an older person, basically you're making them the problem. Whereas if you say, what's great about being older in Osset, what are strengths, what do you like, then you're build people a part of the solution, and it's not kind of like the sort of stigmatizing approach. So that's what we want to look at, assets and good work, which isn't in any way to diminish the fact there are real huge challenges that we're all aware of. It's a different way of working. Next slide, please. So we want to sort of do big numbers. We want to ensure that we've got diverse communities engaged, but we also want to make sure that we go out to groups that may be seldom heard. So we'll need to make sure we're talking to like our homeless population, asylum seekers, and again having some sensitivity about the way that we do that. But we want to use a snowball technique, and that's where I think you will all be very important. So we'll be coming to community champions to say, who should we be talking to? Can we come to your groups? Can we talk to you? And can you help us to kind of get in? So rather than setting up our own meetings, we want to come to other people's and ask them those big conversation questions in those meetings. And then we really want to learn, and we'll need feedback from you as well on that. And we will get stuff wrong, we won't do things right all the time, so we just need to learn that in order to be able to build a much longer 5 to 10 year program around how we do things differently. Next slide, please. So I think the way that we would really like you to fit in, if you would be willing to be, is we'd love to interview you or have a conversation with you. I should have put, that's a bit off, I've gone a bit off brand there by saying be interviewed. So we'd love to have conversations with you as community champions, because we recognise that you hold a lot of really valuable information about the people, you know, about your own experience, but also others. We would also really like you to help us to put ideas forward. So to say, actually, Anna, you know, there's a really good lunch club, you know, at Castleford Heritage Foundation on a Wednesday lunchtime. Can you go there? Or well, actually, the kids do a football match on Saturday in our local park. Do you think you could go there? So we really need you to give us that. And also, if you want, and again, no pressure at all, but say you do run a group somewhere and you're like, oh, well, actually, Anna, why don't you just come along? It won't necessarily be me. There's about 100 people that it could be. And also just helping us share any comms, communication, kind of getting it out there. That's kind of where we're at with it so far. So it's very much, it is a work in progress. But next slide. I think that might be the end. Oh yeah, so the timeline is this: we're doing the communication at the moment, and we're going to do the training in January and February. We're going to run the conversation March to July, a bit of flexibility around that, because sometimes these things take longer than you expect. And then there's going to be the sort of the data analysis and reporting. But we do want to respond straight away. So if there was some hot topics coming up, we'd want to be doing things straight away, not just waiting and saying, hey, guess what, we'll get back to you in a year with our beautifully written document. So yeah, and we would love, thank you Val and everyone who's put stuff in the chat, but that's exactly Val what we would like to do. So you need to tell me how I can do it and how I can do that to the best of my ability. We'd also like to offer conversations over the phone if that works better for some people. We'd like to offer conversations over Zoom if that works better for some people, and then any help we can get with people like yourself, Val, would be fab. So thank you for that. And we'll take Kerry, if we make a note of people that are interested, then we'll get back to you on that. So thanks so much. So I don't know if there are any questions. If we've got time, we probably haven't got time. It's 1 o'clock, isn't it?
And we do have the rest of we've got the data of the vaccination update to go through. So if there are any questions, any burning questions right now, but we do have some people who are saying that they're happy to help in the chat. So brilliant. We'll definitely pass that information on. Yeah, fab. That's wonderful. Can someone capture that information and send it to me, or do you want me to just capture it? I can capture it if you like. It's fine, Anna, either way. Well, you're doing, I'll capture it while you talk to the next slide. And we can send that directly to Paul, Kerry, to put on the action plan. So we've got that. So thanks, that's really great. It's nice. I can't wait to come out to all your coffee mornings. That's definitely a much more fun way to spend my day, I think. Right, next slide.
Oh yes, I'm just going to whiz you through the intelligence. I'm not going to do all the slides, and I will just talk about what we know about Omicron as well, because obviously that's a very fast moving situation. So next slide, please. So what you can see here is our 7-day case rate, and what you can tell straight away from this slide is that lots of stuff has happened to the case rate, but for the last couple of months it's stayed fairly steady. The problem is it's stayed steady quite high, so we're around sort of between 300 and 400 per 100,000, and all of you who've been on these calls for a very long time will know that's very high. So the risk with Omicron, if it is more infectious, and although there's lots of stuff in the press at the moment, some of that's quite misleading, and actually we don't have a really good picture. And just to explain why that is, the first person in this country who got Omicron, that virus was rushed down to the lab in Porton Down, and they started looking at it, but it can take about a week to really understand how that virus is reacting. And also in terms of understanding how it works within our population, because we're very, very different from South Africa in terms of we've got a lot more older people. You need to have at least 500 people with Omicron in this country who before you can understand the impact on the population. So the important bits are, is it more infectious? It looks like it is. And obviously, if you even something that isn't necessarily more serious, if it's more infectious, enough people get it. If 100 people get any illness, 1 or 2 of those people are likely to have a poor outcome. So the risk is that even that what happens is that even if it's milder, which we don't know that yet, that it can still have quite a big impact on health and social care because enough people are getting ill. So I was trying to describe this to Young Health Watch, who are far more intelligent than I am. I was trying to think of a good example, and I suppose the best example I can think is if you've got 1 million people and they all put a penny towards like in the pot. Each person's only put a tiny bit in, but collectively it's a huge amount. And sometimes we forget that even if there's just a small shift across the whole population, it can have a big impact. And that's the really important thing to remember. The other important thing to remember, without depressing you too much, is that sadly, any kind of hospital admissions or deaths tend to happen quite a long time after we see that new variant in the population, because it takes a few weeks for that to catch up. So again, that's why it's very difficult to understand exactly what's happening now, and we need to be cautious, but also not jump to kind of real doom and gloom until we've got a bit more information, which hopefully the lab stuff we'll have this week. And I know that I think there's possibly going to be something on the TV later announcing potentially some stuff, and then I think hopefully in the next couple of weeks we'll know about the 500, the cohort of 500 will give us more information. So next slide, please. So yeah, I'm not going to go through this. It doesn't look good, as you can see, and this is pre-Omicron. And any of you who remember from Delta will remember how we had about 1% of cases that were Delta back in the sort of November last year. By the January, it was nearly 100%, and you'll remember the resulting rise in cases that we had. So yeah. Oh, just to say about the vaccination briefly as well. So again, lots of really misleading stuff in the press, but the vaccination will have a huge effect on Omicron as well. So when there's things bandied around like immune dropout or vaccine failure, that doesn't mean that the vaccine won't have an impact. So that again, that's quite misleading. And also just not to get too techie, but if you have if your T cells are working well, which will be stimulated by vaccination, you're far more likely to be able to fight off any virus. So again, it's very negative. Some of the press stuff I think has been quite misleading and quite negative, but actually it's a bit more complicated than that, and a slightly better sort of news story really. Next slide, please. Yeah, so I mean, I talk about this. I've always talked about this. It's just basically to say positivity is high, and we know positivity high is not good. So well above 10% for Wakefield, and we'd want that to be much lower. Next slide, please. Yeah, John's just on to the next slide. I don't think that's. particularly relevant. So again, you can see this slide's a really good slide always, isn't it? And that top line, you can see the effect the booster jab has had. So you've got that big drop in that 80+ age range, I think 85% of our Wakefield residents who are 80+ have had the booster, and it's gone down, the rate's gone down to 18 per 100,000. So this is really your slide that demonstrates how effective vaccination is. And you can now see that younger, that 60 to 79 age group, they're going the same way, and you'll see that then with the 25 to 59 as the booster goes through those cohorts. Next slide, please. Yeah, next slide, please. I don't think, well, yeah, next slide, please. Next slide, please. Next slide, please. Sorry, just because we've not got much time, I won't. Yeah, I mean, we've got some really high rates in some wards. Again, next slide. And again, that's just the one, you can just see that we've got fairly high rates right across the district. We're not seeing any particular areas of high rate. So I guess like with Omicron, we might expect to see, and you'll remember, those of you who were on these calls for a long time, you'll remember when Delta and when COVID first hit, we did see areas of Wakefield that had much higher rates because the infection got in there first, and now we don't see that because we've got widespread community transmission. So it'll be interesting. My understanding is, unless it's changed today, that there's 8 cases of Omicron across Yorkshire and Humber, and we aren't aware of any in Wakefield district at the moment. So as we see it come in, we may then start seeing those areas, certain areas, being much higher rate, and that will be a kind of quite telling at that point. Next slide, please. Yeah, again, long COVID, we know that for everyone that gets COVID, a percentage are likely to get long COVID, and this just gives you a kind of the idea of the number of cases. But again, I'm not going to go into it because I haven't got a lot of time. Next slide, please. So hospital admissions are looking much better. Obviously, the concern is if we have a variant that's much more infectious, that we'll see those go up again, but we'll have to wait and see. But hopefully, they will. You know, at the moment, it is much better than it has been. Next slide. And then you can see with deaths as well, you know, any death is a death too many. But again, a really good slide to demonstrate the effectiveness of the vaccination campaign. You can see those deaths have remained very low, despite the fact we do still have really high rates. And I think that's the end of my slides. Just vaccination, but I think Darsha's talking about this. But again, just to say that we're doing really well on vaccinations, and we should be very, very, very proud of ourselves. And I know the community champions play a big part in that, because I know you pass on really important messages and build trust. Next slide. Yeah, I think that's it. I can see that someone's put what plans are in place to ensure patients who are in hospital long stay are able to get their booster and flu jabs. And I'm afraid I don't know the answer to that. I think it's Kia, but Dasha may know that off the top of her head, and if not, we can definitely get you that bit of information. So I think we'll probably go on to the next presentation, because I know we've got a lot to get through. Yeah, and I'll hand over to Dasha, sorry.
Thank you very much. So we've prepared a couple of infographics that give a bit of an overview of the vaccination process. Just to say right at the beginning, the 2 slides, the first and second one, have been done on for 2nd of December, and things are changing quite rapidly. So this first one gives you an idea of information of the different cohorts, their eligibility, which vaccine they are getting, and how to book the process and the gaps. You might have seen in the local media that from today, the 40+ers can also book a booster at 3 months since their 2nd dose, so that has changed already. And for those, the booking system will open 1 month in advance. So if they are 2 months after their 2nd dose, people can start looking to book their appointment. And that also applies to those who are at an increased risk from COVID. So if we move to the second slide, that shows us so that is what will be in place from 13th of December. So not yet. And you will see that from here, we move on to some of the changes. So the 12 to 15-year-olds will be receiving 2 primary doses of COVID-19 vaccination, and those who are immunosuppressed will have 3 doses plus a booster. So at the moment, that group has 2 doses and a booster, and that will increase. In terms of boosters, that will also increase to all adults as their cohort is announced, and that will be within the 3 months of the second dose. So that will be similar to what has been changed today. For those who are age 16 and 17, so the second line, who are not in a at-risk group, they should also wait 12 weeks post-positive COVID infection before having vaccine. So we're just adding that information onto the infographic. And people aged 12 to 17 who are clinically at-risk groups are advised to still take up their vaccine offer if they are 4 weeks post their positive test, and then continue to receive their second dose at 8 weeks after the first one. So just a little clarification. For those who are pregnant right now, people who are pregnant are only eligible for booster if they are in one of the eligible groups, but from the 13th of December, anyone who is 18 plus and pregnant, or 16 to 17 and at high risk and pregnant, will be eligible for booster. So that is that information. If we can move on to the next slide, please. We also vaccinating, we are giving boosters to our housebound patients. So there is a little definition of a housebound patient being a person who is unable to leave their home environment through physical or psychological illness. People will be identified by their GP and they will be visited by a special roving team of vaccinators who is made up of healthcare staff and nurses. And they will bring everything that they need to administer their booster to the patients. And those who are recorded by their GP as housebound don't need to make an appointment. They will be contacted directly by the roving team, so they don't need to arrange a housebound visit for their booster. On the next slide, we are looking at flu vaccination. We have had few comments and questions from COVID community champions around vaccination on flu. So just to give the eligibility criteria for children, so that gives those who are 2 and 3 year olds, and then all within primary school children, 7 to 11 years, 7 to 11 within school setting, and also those who are aged 2 to 17 with long-term health conditions. For this cohort, they will receive the nasal spray flu vaccine, and that will be either in school setting or within GPs. Some children might be offered the injected flu vaccine, and we've just given out some of the examples, and that applies, for example, for those who have severely weakened immune system. On the next slide, we've included where the vaccination may take place. So those who are preschool age children will be done within GP surgery, and school age children within school or GP surgery for those who live with long-term condition. Homeschool children will be administered within community clinics. For adults, again, we started, which is on the next slide, we started with the eligibility criteria. From memory, it's 50 plus. If you are pregnant, frontline health and care worker. Could I have the next slide, please? Thanks, Slava, thank you. Or those who are staying in long stay residential care or receiving carers allowance or being a main carer. So that is important. And I know it has been an important aspect for many COVID community champions during the COVID vaccination process as well. Apart from being eligible, it's useful to know where people can get their flu vaccine, and that can be either through GP surgery, through pharmacy that is offering a service, and we've put a link if anyone wishes to book an appointment via a pharmacy. Also midwifery service for those who are pregnant or within hospital appointments. Just to say that for those who are not eligible under the NHS flu vaccination, those people can still get a flu vaccine. They can receive it within community pharmacies by making own personal appointment, but they will be charged for that, and that varies according to the provider. For the next slide, we have a little bit of choose well diagram, and it's just to really just prepare us for winter. and show some of the different ways of seeking advice or support. And again, it's based on some of the feedback that we have received. So for minor illnesses that we can help to look after ourselves, we advise self-care, and as we are heading into winter, we do recommend that people keep some of the essentials within their medicines cabinets at home stock. So for example, paracetamols. For those who want a bit of advice, especially in terms of medication or minor illnesses, including children as well as adults, pharmacists are really skilled medical professionals who can provide advice. I would say it would be the pharmacists themselves rather than perhaps as you enter the premises, but they do have wealth of information. NHS 111 can provide information or signposting. You can access it either online or via telephone call. GP practices, and we do appreciate the feedback we have received from our communities in terms of some of the experiences of making appointments. Just to highlight, the GP practice services can also be accessed online for those who can, and via the NHS app, which is really useful in terms of making appointments, cancelling, seeking repeat prescriptions, or getting results of tests. Urgent care treatment, that is for non-life-threatening illness, but one that is more urgent. And we've got the walk-in centre on King Street in Wakefield, and we've got the urgent treatment centre in Pontefract. And for those situations that are critical or life-threatening, then we do recommend A&E and 999. Just to mention that for all clinical settings, face masks are recommended now to wear, so we would advise, unless there is clinical exception, to wear a face mask, please. For next slide, we want to share a bit of information on behalf of our colleagues from South West Yorkshire Partnership. They have, similar to the Choose Well information that I've just shared, they looked at the Choose Well for Mental Health Guide, and they've prepared information for both adults as well as children and young people. They have worked with service users, with people with lived experience, clinical teams, carers and families to develop this information. And you can download the guide on their website. They have specifically produced information for young people to provide support in mental health crisis. And when we look at mental health crisis, it is where a person is currently in harm but needs really urgent mental health support. And that may be if they are feeling like they may seriously harm or injure themselves or other people, or feeling suicidal, or really no longer feeling able to cope or be in control of their situation. So we wanted to share this information. As I say, it's for both adults and children and young people, which may be useful to be shared. They are sharing it with colleagues across the area as well. So anyone would share is much appreciated. On the next slide is just a quick thank you. I know my colleague Sue came to talk to you about branding for our Wakefield District Health and Care Partnership, and she presented 3 concepts around the logo and some of the colour schemes. The survey gone out with the 3 concepts that Sue presented at the last meeting, and the survey has now closed. We just wanted to say a big thank you to everyone who shared their views. We had over 240 responses, which had quite a split, and there was a lovely category of COVID community champions, so thank you for that. The preferred concept is being finalised based on the feedback, and it will be presented to the partnership board meeting in December, and we are hoping to have the final design available to share sometime at the early next year. Can't believe we are moving into 2022. And on the next slide is just a very quick promotion of survey that we are running in respect of the walk-in centres. So the 2 walk-in centres on Mid Yorkshire footprint, which is the one on King Street in Wakefield and one in Dewsbury. hospital the contracts are coming up to end in September 22, and as part of that work we are doing a review, and we really want to hear from people who have used the services of their experience. That said, it is taking place in the wider concept of urgent care, so even those people who haven't used the walk-in centres can share their views on urgent care services generally. And the survey closes on 3rd of January, so if you can publicise, share or complete would be much appreciated. Thank you very much.
Thank you, Darsha. Loads of information there, and I hope some of you will find that information helpful. We will be sharing some of that information on the WhatsApp thread, and you will get those some of those infographics on the email as well, so thank you. I'm going to move us on now. We've only got 8 minutes left, so I'm going to ask George to speak to the communications update. And George, I'm going to give you 3 to 4 minutes maximum. So what I will say is we do have a meeting again next week, and I know you're going to share Christmas comms. So if you want to skip some bits and come back and talk in detail next time, please do. Is that all right, George?
Yeah, okay, yeah. So if you want to skip on to the next slide then, and then just all I want to say about regarding Omicron is that face masks are now mandatory, so they're compulsory in certain settings. What I'm going to do is I'm going to share with you our supporting business page, the link, and it's got all the settings listed on that page. So just 1 second. So I'm just sharing that with you all now. So if you go to that particular website, it gives you all the settings. Have to wear them in shops and other places like letting agents and estate agents, places like that. So next slide. Next slide. Yeah, our Christmas campaign continues on the theme of let's keep life moving this winter, and our assets are color coordinated to match the theme. So next slide. So you can see this particular one. We've got Santa washing his hands. That's one of the behaviours we're wanting to promote. So the behaviours that we're continuing to promote. Yeah, you can go to the next slide. So we've got one for sanitising if you can't wash your hands. So we're promoting using the app, the booster, face coverings, hand washing and sanitisers, getting vaccinated, using jabs, meeting outside, and getting tested, and also ventilation as well. That's the final one. Okay. And then this is something to look out for, which we'll hopefully be able to show you in more detail next time. We've got some GIFs that are being created. So animated assets that are going to go with a Christmas campaign that I've put together that's based all around Christmas. So if you've gone to the next slide. Oh, it works. So that's a proof of one of them. So this is the kind of messaging we're doing. So this is the message that matches that GIF. So playing on the time of year, talking about elves and Santa, saying that they've been wearing the masks, you know, that they're getting tested, and so hopefully getting people to stop scrolling through the GIF and then absorb the message on the back of it. So that's what we're doing. And then we've got a couple more. If you go on to the next slide, we've got one for Santa about the fact that he's had his booster and his test and he's on the way. And you can see this strap line, this caption, that'll go with the GIF. And then the next one for Christmas, we've played on ventilation because everyone's going to be meeting indoors and having a celebration together. So we've used the Christmas message to go along with ventilation there, and we've got different messages for each of the days. So I think that's the end of the slides. Is there any more? No, that's it. So that's a whistle-stop tour for the communications. Thank you.
Brilliant. Thank you very much, George. We look forward to seeing some more of those GIFs next week. So just to wrap us up, I just want to hand over to Paul Wake, who's been received some funding for COVID Community Champions and has done some brilliant work down in Seskew, which is South Emsall, South Kirby and Upton. So I don't know if you want us to start with the video or you just want to start having a chat, Paul, but over to you. You've got a whole 5 minutes. Please let us know what you've, I know, I'm sure you can talk for much longer, but please let us know what you're doing.
It's fine. And I've just shared, if anybody, if I need to elaborate a little bit more or anybody wants any more information, I've just put my email there in the chat group. Yeah, just to go over, I want to talk a little bit briefly about the things that work for us. I'm just going to really go over on bullet points on this. Don't worry, there's only one slide on this, so we're not going to be going through it. It is going to be bullet points. But I think one of the things that we first identified, particularly based on the information, was that it was going to be, we were going to have to take a long-term approach. So we came up with something that we wanted to use as a vehicle for a long-term approach. So we came up with the concept of Sescu Strong and the Sescu Strong brand. And for those people that don't know or haven't visited the area, each one of those symbols on the Sescu Strong brand relates to a landmark in the towns. Like we've got the South Emsall Town Clock, the Pit Wheel, statue in South Kirby, and then Upton Water Tower that many have seen, I'm sure, if you've gone past or down the A1. So we just wanted a brand, and we also recognise that our community is quite a deprived community, and without getting too political, there's also quite a mistrust of authority. So we recognise that to get that, we've talked about conversation earlier in the meeting, and we recognise that to get that conversation going, we wanted to do it in a quite open, a quite friendly manner. So Hannah, could you just play, even though it's quite generic, Hannah, could you just play the coffee and a chat video and see if we can, you'll get a bit of a feel about the tone that we set with some of our communication.
Hannah, I've got the video ready to play. So if I share my screen and then you can come back on when it's done, is that okay?
Give you a warm welcome to Palms Coffee Lounge. This is my friend Jean and I'm Anne.
Due to government restrictions, we are closed from Thursday. We'll be open as soon as possible.
We will miss you all, but stay safe and God bless.
We'll meet again, don't know where, don't know when, but I know we'll meet again some sunny day.
Okay, I don't think anybody saw the images on that, but it's two great volunteers that we have working down in our coffee lounge.
I want to be one of those weirdos alone. I chose the film because I had...
Quite sure what that is. That's not part of our presentation.
I wanted to make what I call
Poor Hannah's struggling with her screen there.
About something feeling, but it's still want to move at the same time. So we're like in the club, we're partying, we're crying a little bit.
So I'm just going to stop that there. Right, over to you, Paul.
Yeah, so even though we didn't see the images, it's two lovely volunteers that we've got in the coffee lounge there. So it just, even though it was quite a generic message, it just gets over the tone that we took. We wanted to have, to get that initial engagement with people, we wanted it to be quite open. We wanted it to be quite friendly. Again, a conversation rather than a lecture. Obviously, we all know there's a lot of information to go over, and obviously we needed to address some of the false information that was coming over without trying to do it in a patronizing or authoritative manner, particularly bearing in mind the mistrust of authority in our community. So using the Sescu Strong brand as much as we could, we took a multi-pronged approach, really. So it was a mixture of online. We did there's some cartoon information bits that we used, presentations to groups. We did face-to-face meetings. We set up like a signposting or even information sharing service in our coffee lounge, which is actually is great. I can sit there, get on with some paperwork, and people will come up and ask questions, which is absolutely great. So that, you know, we've got that level where we can dialogue and talk with people on this. One of the things that we found was getting that initial conversation going was sometimes quite difficult. Particularly, we tried to be proactive and go door to door as well. And what we didn't want to do is, particularly bearing in mind we're associated with the church, is we didn't want to knock on doors and people be reluctant to open the door. So we came bearing gifts. So we've gone out with small gift packets, gift baskets, essentially just biscuits and some sachets of tea and sweets, and just to open dialogue. We've just gone out, and I think we've got a few more to left that are left. I don't know if you can see there. We've gone out with the Christmas cards with a booster message on the front, some signposted information inside, and then obviously, you know, the brand and a brief message on the back. And it's just an excuse to open dialogue with people. We've done a lot on the associated with the church. I don't know if anybody else has come across this, where people have brought out points relevant to the Bible. I know it's quite a strong thing in America, but it's based on a misunderstanding of the Bible, so we've been able to clarify those points. And then it's building a relationship with the street marshals, the community ambassadors, and just giving them a bit of a base to work from when they work in our area. Plus that's expanded now through Jenny with a weekly test centre that we have indoors. And recently we had a pop-up vaccination with 168 people that turned up, some for the first time. And it's facilitating that as well. It's picking people up, taking them down, making sure people are registered with the doctors, all sorts of really simple things, really. So there we go. If anybody wants me to elaborate or clarify, just send it in an email and I'll get over. I'll send you an email back.
Brilliant.
Thank you very much, Karen.
Thank you very much. Thank you for coming. Thank you for coming and sharing. Any questions for Paul? And I know lots of our community, communities have been having conversations. So that good practice. For anybody else want to showcase any projects that they're doing or any good practice, it's really, really good to hear from everybody. So I think all that remains is to say thank you very much for coming, everybody. Any questions that haven't been answered, we will get back to you. We will look forward to seeing you next week. We've got a half-hour session next week, and hopefully if there are any changes to the current COVID scenario that are announced today, then we'll be able to give you a bit of an update next week.
Kerry, can I just make one brief, really quick point? Another thing we've actually started using now. Obviously, we've got to be careful with transmission and everything. We've just started working with e-business cards. So essentially, all you have to do is download the app onto your phone, pay a charge and everything, and you don't even have to it's contactless, and you can just pass on information. So it's a great way of keeping people updated, and they've got something to take away with them. Sorry, Kerry. Thanks.
We may have potentially lost Kerry. But thank you, Paul, for the update. I believe Kerry was rounding up and saying thank you for everybody's attendance, and hopefully we'll see you back next week. And if there's any major updates, we'll be able to give you those leading into Christmas. So thank you all. Enjoy the rest of your week.
Are we staying on, Jenny?
Normally do, but if Kerry's not here and you've got other places to be, then other than seeing how you are, I'm happy for you to leave. I think most people left previous anyway, so I forgot to look at the participants list before I started chatting.
Right, I just thought there was a conversation that we had.
No, it's generally just a roundup, really. Nothing major, unless anybody's got anything to share. I'll probably
well picked up, by the way, Jenny.
I think there was a Garcia, was there? I need to stop recording.